Good afternoon. I'm Professor Datin Dr. Sapora Sipon. I'm presenting a paper entitled The Effectiveness of Mira Video Games for Stroke and Disabled Rehabilitation Patient on Psychological Condition. Let me read to you the abstract of our paper. This paper is also written by Professor Madya, Dr. Waida Ismail, Dr. Hafiz Hussein, and also Dr. Rosli Ahmad. After suffering a stroke, many patients often experience temporary or permanent disabilities, and these include speech impairment, paralysis, and also memory loss. Many months of rehabilitation enables patients to recover basic functions. However, many of the patients never recover their full capacity. A few has turned to common interactive video games as an affordable and effective alternative for recovery. Thus, the aim of our study was to identify the effectiveness of video games for stroke and disabled rehabilitation patients from the psychological aspects. A qualitative study was conducted using content analysis method, and data was collected through semi-structured interviews using a purposive sampling method with a maximum variation based on some factors like first-hand experience, expertise, and their or the patient's willingness to participate in this research. The study found that video games for stroke and disabled rehabilitation patients proved to be effective. Okay, stroke is one of the 5 leading causes of death and one of the top 10 causes for hospitalization. It is perennially one of the leading causes of human disability, and the effect of stroke is truly traumatic, with survivors living for years or decades after the event. Increasing evidence describe that years of steady decline in several health measures for stroke survivors. Many factors contribute to this. These include further strokes, uncontrollable risk factors, and also the development of late complication of strokes, and also limited access to rehabilitation therapy. And surviving a stroke can be a long-term process that affects many aspects of a person's life. Concerning stroke survivors, early rehabilitation can improve functions and remarkable recoveries. Stroke patients, as the goal of their rehabilitation process is to regain independence and improve the quality of life. Patients need to learn again the skills they lost when part of the brain was damaged. And in the era of Internet of Things, motion-based games are increasingly being adopted for stroke rehabilitation because of their inherent benefits. Among the inherent benefits of telerehabilitation is the potential to solve crucial problems faced by healthcare institutions, including geographical barrier and quality of care. Now, what are the effects of virtual reality games on psychological conditions? The effect of virtual reality games on psychological conditions are many. Some of them are be more economical, more feasible, and much more sellable ways to provide strong and potential motivation for various stroke patients. Moreover, therapists can easily assign rehabilitation motion to patients to meet different goals of therapy. In a related matter, a study conducted by Yang Zuan Huan was carried out to determine the effects of training using virtual reality games on balance and guide ability, as well as the psychological characteristics of stroke patients, such as depression and interpersonal relationship, by comparing them with the effects of ergometer training. And the study found that it is very effective to use video games on psychological condition to stroke patient. There are many studies that relates the effectiveness on video games to the patients who have stroke. The objective of our study is to look at what are the effectiveness of the video games to the stroke patients on their psychological condition. So our study aims to derive an understanding of the dimension relevant to effect of stress and anxiety that are the psychological conditions following strokes, as it is essential to understand how patients view the effect of stroke on patients' life. Another aim of our study is to look at the range of psychological strategies to cope with the psychological impact following the stroke. So what are the methods, or what is the method used? Our studies used the qualitative phenomenological approach, as Dowling 2007 states that a qualitative phenomenological approach was chosen as the most appropriate to gain an in-depth understanding of individuals' perception of the topic of interest. So, in our study, we use a qualitative approach to gain depth and insight into stroke survivors' own perception and experience of their health, and investigate what modifiable and non-modifiable factors that may influence the subjective health experience in the earlier stage of recovery following a stroke. So in our study, we use a focus group methodology because it is an effective format in which to generate a variety of ideas in response to open-ended questions. We ask participants to talk in an open-ended format about how their psychological effect, that is, their stress and anxiety, has been affected by stroke. Who are our samples? Our study uses 15 participants with a range of mild to moderate stroke. They were purposely chosen because they have mild to moderate stroke, and they were selected by using case sampling, whereby participants considered to be clear examples of the phenomenon under investigations. However, patients with severe cognitive or language difficulties or medical conditions help to affect engagement with rehabilitation, for example, depression, were excluded in this study. The interviews were conducted at an average of 4 weeks after the stroke and were tape recorded and transcribed. Now, each interview covered the same general topics, although the patient was free to structure the conversation within each topic. And all interviews were conducted and analyzed by the same researcher. So, what are our findings? Mental health status, cognitive problems in relation to memory and concentration, and changes in mood and affect, including irritability, impatience, worry, anxiety, and feeling low, all impacted negatively on our respondents. Now, reporting of anxiety or depression was common in our respondents. For example, one middle-aged woman, that is Mrs. A, said, psychologically it influences my emotion and also feeling. Honestly, I have many upset moments. It was a little shocking for me. I used to be someone optimistic. That is Mrs. A. Anxiety was perceived to be mostly related to feelings of independence. This involved changes in many aspects, such as in occupational and social status. The slow progress in rehabilitation has caused a few patients to have lack of confidence in being able to carry out some of their usual activities. These include taking part in sports and traveling on his own. A good example is Mr. B. Despite having a good physical recovery, he lacked the confidence in being able to carry out some of his usual activities. Mr. B states that though he was superficially in good health, there was a few things undermining his confidence. However, most of our respondents or our participants reported positive psychological changes that impacted their well-being. Our respondents in many cases are happier, becoming more thoughtful and appreciative. This has led them to value life better and able to value smaller things in life. This includes spending more time with their families and friends. Our respondents describe a range of psychological strategies to cope with the psychological impact of their physical limitation following the stroke. A most common used strategy was making comparison with others, especially to those perceived to be less fortunate and those who had made a good recovery from the stroke, with the latter seen as a source of inspiration and motivation for their own recovery. Our interview also saw other coping strategies used by respondents are to appreciate their health in a positive light. This includes having life goals and motivation for their recovery. Other coping strategies used by the respondents are to appraise their health in a positive light, including having life goals and motivation for their recovery, keeping busy with activities such as returning to usual hobbies and activities as another coping strategies. As a conclusion, subjective appraisal of health after strokes are multidimensions, reflecting a combination of physical, psychological, and coping strategies. The benefit of virtual reality games for rehabilitation help the patient to recover faster. It also serves as a promising approach to bring the game-based rehabilitation system to patients' home and to increase the patient's satisfactions, which leads to lower costs, less commute, and more family or private atmosphere. Anxiety was perceived to be mostly related to feelings of independence. Most of the participants in the study reported positive psychological changes that impacted their well-being. In many cases, they are happier, become more thoughtful and appreciative. The respondents also have applied a range of psychological strategies to cope with the psychological impact of their physical limitations following the stroke. Thank you very much.